Namaskar. I am Dr. Aarti Chaudhary, Assistant Professor in the Department of Ancient Indian History, Culture and Archaeology at Vasant Kanya Mahavidyalaya, Banaras Hindu University. I welcome you once again in this 12-week course titled History of Science and Technology in Ancient India from Harappan Civilization to 7th Century CE. And now we are discussing Module 5, Lecture 2. The title of Module 5 is Sciences in the Vedic Literature Part 1 and the title of today's lecture is Vedic Medicine. First, we have to discuss about the learning objectives of this lecture, that is to understand the connection of Ayurveda to the Vedic text, to know the medical anthropology explained in the Vedic literature, and to explore the knowledge of medicinal plant by the Vedic people. In this lecture, we are going to discuss these subpoints which is visible on the slide, that are ancient Vedic medicine, the Ayurvedic connection, few anatomical features mentioned in Vedic text, digestion, metabolism and elimination, maintenance of health according to Ayurveda, classification and cause of diseases, medical anthropology, process and methods of treatment, the 8 classical components of Ayurveda, and about the physicians, disease, therapies and medicinal plant mentioned in the Atharvaveda. Vedic medicine, deeply rooted in ancient Indian wisdom, is derived from the 4 Veda, Rig Veda, Yajur Veda, Samaveda, Atharvaveda, the Atharvaveda being the most extensive source of medical knowledge. The Rig Veda, the oldest repository of human knowledge, mentions 67 medicinal plants for therapeutic use. The Yajur Veda expands this list to 82 plants, emphasizing purification, rituals and dietary guidelines. The Atharvaveda provides the most detailed insights, describing 288 medicinal plants along with disease, diagnosis, healing mantra and early surgical techniques, forming the foundation of Ayurveda. The Samaveda primarily focused on the therapeutic effects of sound and music. Its hymns were believed to have healing properties. This ancient knowledge system integrates herbal medicine, mantra therapy, and holistic healing, continuing to influence Ayurveda and alternative medicine today. Ancient Vedic medicine, the Ayurvedic connection. If we are going to discuss this, then the points are Vedic origin, Ayurveda, the ancient Indian science of life. It is also called the science of life. The Ayurveda is considered to be an Upaved, auxiliary knowledge of or Upang, part or parcel of the Atharvaveda, which contains hymns and practices related to health, healing and medicinal plants. Systemization in Ayurveda. The medical wisdom from the Ved was later expanded and systemized into Charak Samhita, internal medicine, and Susrut Samhita, surgery, which provide a more detailed and structured approach to Ayurveda. Holistic Vedic principle. Ayurveda follow Vedic concept of balance, that is Tridosh, the balance of these 3 Tridosha like Vata, Pitta, Kapha, natural healing through herbs and spiritual well-being, integrating rituals, diet and yoga. Continuing legacy, the Vedic foundation of Ayurveda continues to influence modern alternative medicine, herbal pharmacology and holistic health practices worldwide. Now, few anatomical features mentioned in the Vedic text. During the Brahman period, we found a detailed observation of human body. The Atharvaveda refers to the 3 parts of the head, which is Sir, Lalat, which brows, Kakatika, part of the frontal bone, and there is a discussion about this bone. There is a controversy. What is the exact meaning of this Kakatika? So different scholars gave their opinion about this. According to Das Gupta, it is central facial bone. According to Monier Williams, it is a part of frontal bone. And according to Harnley, possibly it was bone of the nose and the cheek and the arcs of the eyebrows. So it is in the confusion. And Kapal, the cranium. Again, Hanu word is using for the jaw. The Akshi means eyes. The Brahman Samhita refers to the context of eyeball of the eye. And next is Griva, neck. And other organ which is titled as posterior part, one artery carrying the blood upwards, 8 manas, carotid arteries. Again, anterior part which is kanth, throat, dhamani, windpipe, the thorax, which is also mentioned about Kikasa, thoracic vertebrae, ars, sternum, with 16 jutras, costal cartilage on each side, hriday, heart, which is also mentioned in Atharvaveda, pundarikam, navadamaram, a lotus-shaped organ with 9 opening interpreted by Sayan as the heart. Again, about the bladder, the word is vasti. Urine is conveyed to the bladder by 2 veins called the gavini. The bladder is attached to the vestibule, which is bladder orifice, and mehana, urinary duct. So we can say that the word is different, but the modern science also agree about the knowledge of the Vedic Rishi when they gave the science of Ayurveda and the anatomy which described by them. Now, what the description we found about digestion, metabolism and elimination based on Ayurveda? Agni, digestive fire, is central to all metabolic process, transforming food into energy and vital bodily elements. Digested food is converted into ras. This nutritive fluid is pumped by the heart through 24 major channels that circulate through the body, providing nourishment and vitality. And while flowing through the liver and spleen, it obtains a red coloring matter. This colored modification of ras is known as rakt, blood. Then this explanation is just showing how the blood is prepared or made by the body. Ras transform sequentially into 7 tissues: dhatu, ras, rakt, blood, mass, muscle, med, fat, asthi, bone, majja, bone marrow, and shukra, artava, reproductive tissues. So, this information is very useful in order to understand how the different activities of the anatomy is understood by the Vedic rishis. Important byproducts of this process includes ojas, vital essence, artava, menstrual fluid, and stanya, breast milk. The mal, excretion, urine, feces, sweat, and other excretion from the eyes, ears, nose, mouth, and hair follicles, hair, bodily hair, and nails are all mal. They must be eliminated appropriately to maintain health and balance. Disruption in digestion or elimination can lead to disease. Ayurvedic treatment involves diet regulation, herbal therapy, detoxification, and surgical intervention. So we can understand not only the inner part as well as the hygiene, the cleanliness, the mental thinking, all things is very, very essential to manage for the healthy life which is mentioned in Ayurveda. Now, the maintenance of health according to Ayurveda. These points is mentioning on the slide that support physical, mental and emotional equilibrium. According to Brahman and Samhita, the essential components for maintaining good health and overall well-being. Key aspects include being mindful of environment and lifestyle caution, such as avoiding pollution and unhealthy habits. Practicing personal hygiene is crucial in preventing infections, and a priority is cleanliness. It is important to avoid the suppression of natural urge, as doing so can lead to physical and mental imbalance. Regular exercise and walking help improve circulation, boost energy, and maintain a healthy body weight. The elimination of waste is vital for detoxification and preventing the buildup of harmful substance in the body. Last, taking protective measures such as staying safe from the environmental hazard and infection disease further contributes to a healthy life. Together, these practices create a holistic approach to health and wellness, which is mentioned in the Brahman and Samhitas. Now, the classification of cause and disease. Till now, we have discussed what is essential to be the very healthy and very sharpness for the mind, which procedure should followed by the human being. And now the classification and cause of different diseases which found in the Ayurvedic text. Classification based on the humors, dosh and blood. Vata related disease. It is disorder caused by an imbalance in Vayu, air element, affecting movement and nervous functions. If Vata is disbalanced, then this is the cause. Pitta related disease, condition due to excess Pitta, fire element, impacting digestion, metabolism and body heat. The cough related diseases, eliminates arising from cough, water and earth elements, leading to congestion, sluggishness and excessive mucus. Rakta, blood disorder, disease caused by the impurities or imbalance in blood circulation. Dwell dose imbalance, when two doses are aggravated simultaneously. There is 3 doses we already discussed. Vata, Kapha and Pitta. If 2 doses are aggravated simultaneously, then it is called dual dosh imbalance. And the 3 doshic imbalance is also called sannipatik, when all 3 dosas are disturbed, often leading to surge or life-threatening condition. It is very tough condition if 3 doshic imbalance found in any living being. Classification is based on causes, that is adhyatmic, internal cause, originating within the body or mind. It is divided into 3 parts. Adi Bal Pravartika, it is hereditary or genetic disorder. Janma Bal Pravartika, acquiring during parental conditions. And Dosha Bal Pravartik, that is caused by diet, lifestyle or behavior imbalance. If in these kind of imbalance occurred in any personality, then it is called, this patient is suffering from the adhyatmika. It means internal cause of the disease. Now the external cause. Adhi bhautik, resulting from environmental factors, which is also divided into 2 parts. Sanghata Bal Pravartika, physical trauma, accident or poisonous bites. Second is Kala Bal Pravartika, Kala Bal Pravartika, that is caused by seasonal or climatic changes. The third division is Adhi Daivik, divine or uncontrolled cause, arising from the faith or supernatural forces like Deva Bal Pravartika, attributed to divine or supernatural factors like curse, epidemics or natural disasters. Swabhav Bal Pravartika, natural process such as aging, hunger, thirst and mortality. So these are the basic characteristics which is responsible for the different type of disease. Now, medical anthropology, which is given in the Ayurvedic text, that is divided into different parts, which is holistic diagnosis, individual differences, heritability versus acquired condition, environmental shift, special patient group, anatomical indicators, and etc. If we want to understand these all points, then medical anthropology plays a crucial role in understanding health and illness through a holistic lens that considered both biological and socio-cultural dimensions. It emphasizes holistic diagnosis, recognizing that a patient's condition cannot be fully understood without considering their lifestyle, belief and social environment. The lifestyle is very important in the field of Ayurveda, which is responsible for the different disease. The disciplines explores individual differences, acknowledging that genetic makeup, cultural background and personal experience significantly influence health outcomes. It also delves into the distinction between heritable and acquired conditions, helping to differentiate between illness passed down genetically and those shaped by environmental or behavioral factors. Additionally, medical anthropology investigates environmental shift, how changes in climate, urbanization, and lifestyle pattern impact human health. Attention is also given to special patient group such as the elderly, children, or marginalized community. So it depends the age of the patient and the space of the patient from where they came. Lastly, the anatomical indicators are studied not only as biological signs of disease but also in the context of how they are interpreted and treated across culture, offering a more nuanced understanding of health and healing practices worldwide. Process of methods of treatment. We saw the disease, for the factors of the disease, the different factors responsible for the disease. Now the process and methods of the treatment. Treatment consider both mental and physical aspect of well-being. All practices aim to balance the guna, quality, dosh, dhatu and mal, waste products, on a long-term basis. No distinction is made between diet, hygiene, preventive care and treatment. A common foundation approach is adopted in Ayurveda for all type of pathological condition, and that is Samsodhan, cleaning and evocative therapy, Samsaman, pacification and rectification, Ahar, diet and oral medication, very important in Ayurveda, as well as in the medical science as well, Ahar and Achar, condition and medical regime. The public hygiene is an important aspect of Ayurvedic principle and is not overlooked in maintaining individual and community health. Now, the 8 classical components of Ayurveda. On the basis of these factors, the whole treatment of Ayurveda considered. As first mentioned in the Mahabharata, the classical Ayurveda text describe medicine as having 8 branches, 8 ang, Chikitsayamang Gayam. They are Kaya Chikitsa, general internal medicine, Kaumarya Bhritya, pediatric and obstetrics, Shalya Tantra, surgery, Shalakya Tantra, ENT, eyes, ear, nose, throat, Bhuta Vidya, psychiatry and disease of supernatural origin, आगाध तंत्र, टॉक्सिकोलॉजी, रसायन तंत्र, रिजुनिवेशन थेरेपी, वाजीकरण तंत्र, एफ्रोडिजियाक थेरेपी. The Ayurveda also describe the behavior and the role of the physician, and they are: a practitioner in Ayurvedic medicine was accepted to be a qualified person in all sense of the term. Possesses self-control, courage, compassion, integrity, intelligence, memory, insight, and purity of mind and body. Master theoretical, textual, and practical knowledge of Ayurveda. Undergoes long-term study and practical training under expert teachers. Gains broad understanding of related sciences and philosophies. Demonstrate independent observation and application skills before practice. Secure a state license for independent medical practice. We can say, in the field of Ayurveda, a physician is expected to embody excellence not only in knowledge but also in character, hygiene, and cleanliness. The person must possess the qualities like self-control and courage, compassion, integrity, intelligence, purity of mind and body, so that he can control, he can just rectify, he can diagnose the particular disease of a patient. Therefore, practical and textual knowledge is also very important, which achieved through deep study and rigorous hand-off training under the guidance of expert teacher. Additionally, a well-rounded Ayurvedic practitioner gain a broad understanding of related science and philosophical system, enhancing their ability to perceive health holistically. Before being independent practice, they must demonstrate keen observation and the ability to apply their knowledge skillful and ethically. Finally, obtaining a state license ensures they are qualified and authorized to practice independently. So the rules and regulation is also very strict for in the Ayurveda, and on the basis of this discipline, and Vaidya of Ayurveda can very scientifically diagnose a disease of the patient and cure that particular diagnosis. If he is or she is disciplined, then it will happen. Otherwise, it is very difficult to diagnose the disease. The other points are: for the physician, prioritize patient welfare above personal gain or fame. Treat only morally deserving individuals. Abandonment or harm is strictly forbidden. Provides full treatment facility including a dispensary, nurse and medicine preparation. Maintains patient confidently and follows ethical conduct during home visit. Treat each patient with full care as if treating his own child. Continuing learning throughout life, engaging in discussion and professional growth, leads a disciplined, modest life with kind manner and compassionate service. It is so in Ayurveda, not only disease, method, cure is explained, all those explain about the personality of Vaidya, a physician, a doctor, and their role. Now the disease which is mentioned in Ayurvedic text. Fever. Fever is called Takman. Fever are classified based on duration, like Ubhayesu, 2 days fever, Tritiyak, 3 days fever, Sadandi, prolonged fever, Haina, year-long fever. Deities like Agni, Som and Varun are invoked to drive away fever. So in Ayurveda, spirituality is also a inseparable part for the Ayurveda. The medicine, hygiene, healthiness, the discipline of life, as well as the belief of the spiritual power is also the important part of Ayurveda. Now, Krimi. The information regarding the Krimi is a microorganism referred in several texts. Sun bathing is essential for the treatment Krimi. as ultraviolet rays from the sun effectively eliminate these germs. So, the Ayurveda also suggests that the sunlight is very important for everyone. The Haim creamy ghana is also recommended for combating creamy. Internal pain, which is called colic, is also explained. Like Bisuchi is mentioned in the Ayurveda as a sharp internal pain like an arrow in the heart or stomach. Vedic hymns describe this pain as caused by Rudra's arrow, and prayers are offered to remove the affliction. Scholar M. Bloomfield interpreted Bishuchi as a digestive disorder treated through ritual healing. Now the problem related with the urinal problem and or diabetes. Asarva refers to painful urination, possibly for the diabetes. Prayer made of god Prajanya for regulating urine flow. Munj, reed stalk, is suggested as a herbal remedy for this disease. Haim also address urine retention and constipation. Next disease is cough. Kas means cough caused by imbalance of vata, pit, wind, pitta, bile, cough, phlegm or bad weather. Caused by an imbalance of wind, bile or phlegm or bad weather, it is happen. Described as cold born and wind born. Herbs vanaspati relieve pain gradually. We all know that Ayurveda is basically related to the vegetation also because it is completely herbal. The next disease is Yakshma. Yakshma is a disease that causes physical weakness and inability to work. Yajurveda mentioned 100 types of yaksha. Two main types of yaksha are Raja Yaksha, identified with tuberculosis, and Ajanta Yakshma of unknown origin. Also classified as Raja Yaksha, Papa Yajma, Janaya in Yajurveda. Raja Yakshma affects the whole body and remedies includes herbs like Ajana and Gugulu. The bone fracture is also mentioned in the Vedic text. Like in Atharvaveda, there is a Shukta in Atharvaveda about the disease Balasa. Balasa cause bone and joint weakening, settled heart related disorder, discomfort in limbs and joints. Atharvaveda also mentioned the Haim prayers for the removal of Balasa from the body. So we can see here that not only the treatment or the medicine as well as Vedic rishis just wrote mantra for the healing of that particular problem because they know the power of the sound, they know the power of the word which just incorporate with the for the positivity of the universe, and it reflects for the health reason in the human being. Jaundice is also mentioned in the Vedic text. Kamala, jaundice and Hridaya Roga, heart disease, are described in Atharvaveda. The sun god is invoked as the healer for both disease. Sir Brahma prayers for relief from both diseases. Hereditary disease is also mentioned in the Veda. Like the Atharvaveda use the term Kshatriya to refer not a warrior class but to hereditary disease as interpreted by Bloomfield. There is controversy about this word. According to Bloomfield, it is not a caste, it is a hereditary disease. Haim in Atharvaveda are designed to drive away hereditary family disease. The Taittiriya Brahman mentioned disease arising in the womb using the term Kshetram. These refers suggest an early understanding of congenital and hereditary illness in Vedic thought. Galagandha. Galagandha refers to a disease affecting the neck, shoulder, and throat, often associated with the pain and swelling caused by apacid, an insect-like entity believed to trigger the condition. Atharved mentioned 55, 50, 55, 77 and 99 types of Galagandha, describes apacid as being red, black and white in color. It also mentioned in the Atharved that disease is leprosy, kilasa. Leprosy as kilasa in the Ved. Atharved described kilasa as a condition associated with the white discoloration of the skin. Vedic remedies for leprosy is asikinis, a herb born at night, believed to be remove grey and white spot caused by leprosy. Asuri, another healing herb said to restore normal skin color, and Syama Tulsi and Rama Tulsi Neeli, effective in curing Shweta Kusht. Now the therapy which is mentioned in the Vedic text, that is Aushadhi therapy and natural therapy. Aushadhi therapy is based on Vanaspati and Aushadhi, and the natural therapy is Vata therapy, soil therapy, water therapy, mantra therapy, solar therapy and psychotherapy. So we can see the all treatment process is based on the natural resources and the which universe provide with the natural form. So we can say natural therapy like Vata, soil, water, mantra, solar and psychotherapy work holistically to restore balance and health. Vata therapy calm the body and mind. Soil and water detoxify and refresh. Mantra uplift spirituality. Solar energy revitalize, and psychotherapy heals important balance, which together promoting overall well-being naturally. Now the different medicinal plant in Ayurveda, that is Api marga, Achiranthus aspera amaranthesi, cure supernatural disease, bronchitis, pain relief, swelling, etc. Next name is Gugulu. We all are very familiar with this name. Gugulu. Commiphora, Mukul Ingle, used as the medicine of Yakshma, Shama. Kustha, Sausuria Lappa Clark Composite, widely used in cure fever. Next is Som, Sarcostema acidum, White Brevistigma, W&A, Asclepias, remove of poison. It is used for the remover of poison. Next is Gangida, Grovia populifolia, Tiliaceae. The plant is used against a variety of disease, fever, takman, internal sores, balasa, etc. So it is very important. We can see Neeli, Indigofera, Tinctoria Lin, Papilli Onesi. So these kinds of plants are really very important, and they are continuing in the present world, and we have to preserve these kind of plants for the well-being and for the health maintenance, and not only for the health and well-being, these are also very important for the hygiene, maintenance of the hygiene of the universe and the whole atmosphere and the purification of the climate. These plants are very significant. Now, on the basis of whole structure like the methods of disease, the therapy mentioned by the Ayurveda, and the different medicinal plant, the behavior of the physician, and the whole structure of the treatment, we can see the Vedic medicine as embodied in the Ayurvedic tradition represent a sophisticated and holistic approach to health and well-being, believed through centuries of observation, practice, and philosophical inquiry rooted in the Vedas. It integrates physical, mental, and spiritual dimensions of health, emphasizing the balance of bodily energies, dosha, proper nutrition, ethical conduct, and alignment with natural rhythm. Its systematic diagnosis methods, individualized treatment, and focus on preventive care underscore its relevance not only as a historical system but also as a complementary framework in contemporary healthcare. The enduring legacy of Vedic medicine highlights its potential to contribute meaningful to integrative and global medical practices. So, on the basis of these information, we can say the Ayurveda is really the science of life where not only these survival practices depends on the personal hygiene as well as it also consists the hygiene in the environment, the safety of the different valuable plants, and the complete well-being for the not only for the human being, the complete well-being for the whole environment, climate, and the universe. So these are the basic references which definitely help for your better understanding on this subject. You can study, you can consult these references, and we will meet soon in our next lecture. Thank you for your patient listening. Namaskar.